Hi everyone, Dr. Kulla here. Can we use your first name?
Uh-huh.
Casey. She is another contortionist. So we see a few contortionists here in our New York City office, and tell us a little bit about what you do as far for, contortionism. And not everybody does the same thing. Not everybody's in the circus, right?
Right. I mostly have been working in a lot of sideshow events, and I work a lot with burlesque and drag companies, normally as the variety show act.
Okay.
Um, However, this past summer, I spent teaching at a summer camp for children, like contortion and mime and clowning.
Okay, so a lot of variety with what you do. Okay, so can you show me? I mean, there's a lot of variety in what you do, so your acts probably change. What kind of motions do you do? By the way, she came in here for upper back and right shoulder pain. So we've already seen her once at this point, or twice. Twice. I'd have to look up your notes here, but at this point, I want you to show us some of the things that you do, some of the stresses that you might put on your shoulder or your back.
So, for example, see this one's facing the bend. Not super warm, but I'll try to do my best.
Wow.
Landing.
So a full wheel.
Full wheel.
Okay. Be careful, there's a lot of equipment nearby here.
Elbows.
Wow, okay.
And then you come.
Okay, do you go all the way up onto your feet with all the weight on your elbows? Wow, so you can't see it, but she's grabbing her toes here. Okay, all right, you can go ahead and stand up. Wow, okay. I could never do that. Now you are double jointed, I assume.
Yes.
Yeah, so I was saying before another video we did for another contortionist that most contortionists are double jointed. Also, something that you want to check if you're double jointed is if you have Ehlers-Danlos. Ehlers-Danlos is a syndrome that causes extra laxicity in the ligaments and tendons. And there are things that you can do to fight that depending on how severe of EDS that you have. So that's something that we want to get checked on for her to see if she has that. But that being said, you can see the stress that they put their joints under. It is insurmountable. So we're going to go ahead and do a check on your shoulder first. So I'm going to have you lay face down. Put your hands on your lower back. Okay, palms up, and this elbow up, and this elbow up. Yep, and I'm going to push down, resist me. 1, 2, 3, raise both elbows. 1, 2, 3, resist. Good. Any pain? Okay, good. Turn over. Actually, relax your arms here. Okay. Her scapulas are even. You can go ahead and just relax here. We're going to correct your pelvis for starters. And any elbow pain? No, okay. All right, so let's have your left side up, left pelvis up. And bend the top leg here for me, yep. Good. Take a deep breath in and blow all the way out. Good, and the other side up. Now, normally, contortionists are difficult to adjust. They're very flexible. I don't know. I've been doing this 20 years, and I rarely have a problem adjusting anybody. There's been maybe a few, one or two. in my career that are a little more difficult, but after time, after a week, 2 weeks, it's usually much easier to get motion from those difficult locked up areas of the spine and relax here. And with her, I don't even have to use much force at all. Very gentle adjustment, good. Yes, now we're gonna check your shoulder here. Do a couple more tests. I want you to put your arms straight out. I'm gonna push down, I want you to resist me. Okay, and on three though. 1, 2, 3, resist. Okay, this one kind of gave out. Did it hurt? Okay, what about this one? Okay, they both gave out a little weak. Was one painful? Not even a little bit? Okay, we're gonna try that again. We're gonna lower it a little bit, and I'm gonna push down. I want you to resist me. 1, 2, 3, resist. Okay, no pain, right? Okay, now palm out, and I'm gonna pull out this way, and then I'm gonna pull this way. So what I'm doing is I'm testing the pec major and the sternoclavicular joint, okay? Pec major test on count of 3. 1, 2, 3, resist. Okay, a little weak. And 1, 2, 3, resist. Okay, that was a little weak too. Any pain when I did that? Okay. She may have a high threshold for pain. Everybody's different, so it was definitely weak. And we're gonna test it, compare it to this side. So pec major on the count of 3. 1, 2, 3, resist. A little weak, and 1, 2, 3, resist. Okay, and relax there. And this side up again. And 1, 2, 3, resist. 1, 2, 3, palm out. 1, 2, 3, resist. Okay, and I'm gonna have you stand up and face me. So another way we can do is check her sternoclavicular joint and see if one is higher than the other. And in this situation, they're both level. This one's a little forward, but they're both even. And we adjusted that last time, if you remember. So that held, that's good. Okay, so let's have you lay on your back. Okay, and we're just gonna loosen up that pec major. So I'm gonna take your hand and cup the fingers. And we're just gonna loosen that area up just like that. Good, just above the breast and below the collarbone. Yeah, and you can go in a circular motion, use the pads of all your fingers in there, like this. Yep. Yep, you can also use a lacrosse ball, okay? We'll give you a lacrosse ball today if that'll help. Good, good, and okay, now relax there. And we're going to test that again, the pec major again. 1, 2, 3, resist. Good. Okay, and relax there. And then this one was positive too. So you're going to do the same thing on that side. Just relax your arm. So what she's doing is in a circular motion with her hands, loosening up the pec major. Again, it's just below your clavicle and above the breast. And go right into the armpit or all the way up to the armpit and just below it. Yep. And get in there pretty good. Use some elbow grease in there. There you go. If you have nails, just use your finger pads, not your nails, okay? Yep, so cup your fingers like this, like you're eating dim sum, all right? And just finger pads, not the nails, okay? And so like that, yeah. Okay. Okay, let's test it now. And on 3, 1, 2, 3, resist. Good. Okay, relax here. So the good thing is her clavicle held after the adjustment we did last time. Now my guess is in the last couple days since I've seen you last, have you done any contortionism or?
I've done some training, but my coaches are aware of what's going on, so they haven't pushed me.
They haven't been pushing it, okay. And are your coaches, are they contortionists themselves?
Yes, they are.
They're just retired?
Mm-hmm.
Okay. And relax yourself here. Good. Okay, now we're going to treat her with cold laser therapy to heal the soft tissue in the shoulder. So stay tuned for that. Okay, we're going to use the MR5 Active Pro laser with stim on Casey here. And what this is going to do is it's going to help me find any areas of inflammation or soft tissue damage in that right shoulder area and upper back. We're going to scan the whole area. I'm starting on the left for a reason. What we're going to do is start along the top, the supraspinatus, infraspinatus. This uses an impedance meter to detect areas of inflammation, and right there on her levator scapula, and you have trigger points there probably that are tender. That's a big one for you. So this is going to melt that trigger point away. It's really effective for trigger points. For me, I have every disc in my neck herniated. I have spinal canal stenosis. I've had so much trauma and accidents that I get pain when I sit for a long period of time, like on an airplane or something. So I laser before I get on a long flight, anything over 4 hours, and I never have to think about it. And here you can see right along her supraspinatus muscle. I'm sure it's not damage, I'm sure it's just inflammation, but it's a very common area, especially for desk workers, people that sit in front of a computer all day. But now with our tablets and cell phones, very common to get trigger points across the top of the shoulders. Now, how's that, by the way? Better? And it might still have to scan it. We're going to scan back over it again because there might still be some inflammation, so we'll just double check it. And oftentimes I would say about 10 to 15 laser sessions can really heal and repair soft tissue damage. One laser treatment will make a difference right now in your pain and inflammation, and it may last a couple days, but ultimately to do 10 or 15 sessions of this will really heal and repair the soft tissue. So when I say heal and repair, that could be an old tear, it could be a surgical area where the tendon was repaired, so it breaks up scar tissue, muscle adhesions, inflammation from tendinitis, for example. So a lot of artists have tendinitis because they're using their hands all the time to create. So that's what I mean by tissue healing and repairing. It just depends on what the problem is, whether it's a tendinitis, an inflammation issue, or whether it's an actual damage to the tissue where it was torn and repaired, or whether you have muscle adhesions because it's an old injury that was never treated properly. So it found a little inflammation in here too. All spots that you have pain and discomfort, aren't they? Mm-hmm. Yeah. And now we just go around again to make sure we didn't miss any spots, and that's the insertion of the supraspinatus right there. And it takes about 5 minutes to scan this area, depending on how bad damage is. We've had people needing shoulder replacements. That could take 10 minutes to scan that shoulder. And it tells me even how long to dose the area too. So it depends. It could be anywhere from a minute to a minute and a half. In some cases, even longer. There it was short. It was about 30 seconds because we already went over that spot once before. And our last spot here, which we went over once before too. And sometimes it will dose the same area twice. All right. So what kind of motion was hurting your shoulder initially? Raising it up and down? Okay. And I pushed your hands down when you were in that position. Did that hurt? Okay. So it doesn't hurt when there's pressure against it or force against the arms. So in just a second here, I'm going to have you raise your arms and go ahead and tell me how that feels. Any problems there?
so nice. It's tender here, but it's not pain. If that
Okay.
makes sense.
Mm-hmm.
So, whereas before, if I raised it, there would be pain.
Okay.
I don't know if that makes any sense.
Yeah, it does. I want you to sit here, right here, cross your legs, straddle the table here, facing that way. One leg over the edge there, yep. Cross your arms in front of you. Okay, and tuck your chin down. Take a deep breath in. Keep that chin tucked. I'm gonna bring you back. Deep breath in. Okay, deep breath in again, yep. And blow out, keep the chin tucked. And head back. Good. Okay, now come on up. And go ahead and raise that arm up again for me.
So much nicer.
Better?
Yeah.
Okay, you're all set. Thanks for letting everybody see what you do and all those crazy contortions. You got any more to show us? Don't be pressured here.
I'm not very warm.
Okay. All right, so we don't want to injure her. She's not warmed up.
Sorry.
Thanks for tuning in, everyone.